Hi, I'm Dick Rogers talking about elderly care. I think the care of our elderly people in this country should be organised by the government, through the NHS, and not through commercial old people's homes and nursing homes. They should be looked after in government premises, looked after by government staff, out of government money, raised out of general taxation. And we shouldn't make them sell their houses. An inheritance keeps the family together. I think if we make elderly people poor because we charge them for elderly care until they're so poor that the state covers it, I don't think that's good for family integrity, for keeping families together. If granny or grandpa or mum and dad have a house to bequeath to their family, I think for motives which may not be entirely pure, that is an influence to help keep the family together. And I don't think we should invalidate that by making elderly people, paupers. And I think looking after us in our time of need, which is mostly now in old age, that's the greatest time of need, should fall under the responsibility of the NHS. At the moment, the most likely time you are to need care is when you're old, and a lot of that is not covered by the NHS, and I think that's a disgrace. I think it should be. I think the insurance schemes that the government has been considering are not the answer. They pay businessmen to look after our entire, or a lot of our elderly people. It's a job that we know we're going to have to do. We should be able to plan for it, and we should be able to do it ourselves in-house instead of paying self-interested businessmen to do it for us. I reckon good old NHS. Let's have more of it. NHS is a way of sharing the risk and sharing the costs, and we should do that in the expensive business of looking after each other in old age. We should do it in-house instead of farming it out to companies. I think such a step would be jolly good for the following reasons. I think it would help us to develop a professional structure amongst those who care for elderly people, and it would secure pay scales, because some of the pay of people working for commercial companies is not very good, and I think also the pay structure can be used as a way of honouring those who do the actual job of looking after elderly people, and it can honour the right kind of demeanour to bring to the job. I think it's much better for training to have an organised structure so that those who have got good experience of looking after elderly people can train those who are coming up through the system. I think it's good for kit, for equipment, because we should be able to develop and provide equipment which helps make this difficult job a bit easier. I think it's good for buildings, for providing suitable premises to look after elderly people in. I suppose the fear is that they would just look like institutions, but we can overcome that. And I think it's good for fostering ethos and standards. I don't think it makes sense to have it all in private hands and then have a government body going around inspecting. I mean, it's better than not even inspecting it. But I think it makes more sense to take over the system and organise it properly ourselves and make sure from the inside that the standards are high. I think it's good for community engagement. I think if the old people's home or nursing home down the road is known to be that of our society, that's how we look after mum and dad, then I think that would help schools to feel that they can be involved there. I mean, there could even be a sort of community liaison officer for the old people's homes and nursing homes of a particular borough or something like that, to help musicians who want to perform, or actors, or people putting on variety shows and things like that, to do that. And I think it could make such old people's homes and nursing homes really nice places to go, where the families would want to go, and where elderly people would be happy. I mean, it probably wouldn't be as good as being in their own homes, but it would be a jolly good alternative, and there'd be life going on around them. And I think this is the way to plan a good service. The present system, I don't think, makes it easy to plan an adequate service, a good service for care of the elderly. And I think this system would enable better coordination between this and other parts of the NHS, particularly the acute hospitals and the general practitioners, so that the NHS can work in a sort of sensible, coordinated way. And I think it's good for research. We can research into how to get our care of elderly people better, and what drugs to use, develop new drugs perhaps, and new equipment and new methods of doing things. I think it'd be jolly good for morale. I think it would improve morale in the service, and I think we should end the conflict between the artificial divisions between social and nursing care. I think it is nonsense to have care of people at home divided between social care and nursing care. It's an arbitrary division, and a lot of the effort is put into working out how much care one can wriggle out of funding. And I think it would be much better, therefore, if it all came out of the same pot of money, which should be the NHS budget. And I'm a Christian. The Bible says honour your father and your mother, and as a society that's what we should do, and I don't think we should make them paupers by having to pay for their own care. I think we should do it ourselves. Our own generation should look after our elderly people, and we shouldn't bump them off. Let's not have any euthanasia. Let's not have the legal opportunity to sign a piece of paper saying that your life can be ended prematurely. It's impossible that it would not be seen as that people would see that they were an expense, to be a burden, to be looked after, and a drain on subsequent generations, if such a legal opportunity existed, and it shouldn't exist. And no other party is looking at things in this way, as far as I can see. None of the major parties has got anything radically departing from the present direction that elderly care in the NHS is going, and the Common Good Party has. And I would love you to take issue with your MP, go and see them, have a public meeting about it, raise a petition about it, and if you can't get anywhere that way, then consider contesting the seat at the next election on this very, very important issue, or a whole collection of issues which the Common Good Party is standing for. Thank you very much indeed.